Today we will talk about stroke. Stroke is the third most common cause of mortality in high-income countries. A stroke can be caused by either a blockage in a large artery, a disease of small arteries, poor blood perfusion to the brain, or a thrombotic event, which is called ischemic stroke. Alternatively, it can be caused by bleeding, which is called hemorrhagic stroke. Risk factors that can lead to a stroke include high blood pressure, smoking, an unhealthy lifestyle, alcohol consumption, obesity, diabetes, sleep apnea syndrome, atrial fibrillation, high cholesterol, and carotid artery blockage. These risk factors can be avoided through lifestyle modifications and the application of therapeutic methods as needed. Stroke is a medical emergency. Both physicians and the general population should be able to diagnose it based on certain criteria. These criteria include observing facial asymmetry. One side of the face may droop compared to the other, weakness or numbness in one or both upper limbs, and speech difficulties where the patient cannot repeat simple sentences like, "The sky is blue." However, the most important factor is the time since these signs and symptoms began, as treatment is urgent. If a patient is unconscious, the airway, breathing, circulation, and exposure to external factors must be immediately evaluated. We must emphasize that stroke is an emergency, and every minute counts for the patient's future. If the stroke is an ischemic stroke, treatment with thrombolysis within a 4 to 5 hour window increases the chances of a favorable outcome. Approximately 25% of individuals with a history of stroke die within the first 2 years after it occurs. An unfavorable prognosis is more common when coma and paralysis of one side of the body are present. Among stroke survivors, approximately 30 to 40% remain alive 3 years after the stroke. 1/3 of patients gradually recover their mobility, while 1/3 will experience disabilities requiring institutional care. It is crucial for everyone to recognize the signs of a stroke so that the time it takes to provide care is minimized, thereby increasing the chances of survival for the affected individual. Thanks for watching. Don't forget to subscribe to my YouTube channel for more valuable content.